Next up now, I'd like to introduce Luke Peter Silke. Luke Peter first came to my attention. He was writing wonderful blogs that really were capturing what's happening in Ireland as regards current affairs and things that are really quite wrong in the country. Beautifully written and very, very reasonable. And since then, I have got to know Luke Peter, and Luke Peter is from Galway. And tonight he's going to chat to us about what happened when he sent in a Freedom of Information request in relation to Mayo University Hospital. So, Peter, I suppose the first thing that I'm really curious about, how did a man from Galway become interested in the case of a hospital in Mayo?
5th of May, when the issue dramatically raised at Department of Health press briefing. Now, it was interesting. The case that was raised at that specific press briefing, that of Sally Maz, who was a student, a young 17-year-old student from Ballyhonus in Mayo, and they were alleging that she had been moved to ward. She was a heart patient, I believe. She had a heart condition in hospital, and she was moved into a COVID ward just shortly before she died. Now, I have a friend there in Mayo, in Knock, actually. Paul Lawless is his name, and he's involved in politics. He's contested a few elections and that. So I got in touch with him, just curious, I suppose, as to whether or not people in his area were raising concerns with him of a similar nature. And sure enough, he said they had. And then another case broke, and that was of Jackie Carolan. He was a 79-year-old man from the Ballina direction, and he was a stroke patient. And very similar kind of story to the student in Ballyhonus. He was a stroke patient, and he it seems contracted the virus in the hospital and subsequently died. So the allegation that was being made by many people was that they were being moved from non-COVID wards into COVID wards within the hospital, that there was crossover between staff and patients, and that there wasn't really any control. The virus was spreading pretty rapidly in there. Now, Paul Lawless, my friend in Mayo, he's involved in the party Aimtu. So he raised the issue then with his party leader, who's Peadar Tobin TD. And Peadar put in a written question then to the Department of Health on the issue. And the Minister for Health at the time, Simon Harris, promised that he was seeking a report from the HSE on the issues of crossover in Mayo University Hospital. Around the same time as that written question, I would have issued a number of Freedom of Information requests myself, and so would my friend Paul. And we did get stuff back. So we got correspondence. We targeted the office of the Chief Medical Officer, Tony Houlihan, and the CEO of the HSC West, the SAILSA group, here in the west of Ireland. And we got a number of documents back from both of those requests. And one of those documents then identified a third case. So we already had the case of the elderly man and the student, but there was a third case. Now, the names were redacted, but it was evidently a different case to the other two because it concerned a cancer patient whose family were alleging in a complaint to the Department of Health and to the HSE that their loved one was moved and that there were no protection controls in the hospital. So what was fascinating about that is that case and that complaint wound up on the desk of the Chief Medical Officer the day that the issue was raised at the press briefing. So it was very strange to see that there had been a kind of an internal Department of Health discussion about this in advance or on the same day as the issue was raised at the press briefing.
So if I could just pause you there, a journalist from Mayo actually raised this issue with the CMO, Dr. Tony Houlihan, at a press briefing, and actually she was castigated for several days across social media, and a lot of people might remember that incident, and I think it actually was covered in some of the mainstream papers at the time, and certainly was covered in the papers in Connacht. So suppose that was a classic case, really, of the messenger being shot.
I suppose it was. Now, I didn't necessarily agree myself with, I suppose, the conduct at that press briefing. I felt that there were too much badgering or that sort of thing. And I believe she said she was there from the, I think it was the Western News. And I don't think such a publication exists. So I wouldn't have gone about it in the same way that she did, but there's a story there undeniably, you know. So when we got the stuff back and we identified this third case, there were two journalists that were real eager and you know, have been covering this story. One of them was Catherine Fegan in the Irish Independent, and another one was Teresa O'Malley with Midwest Radio. So they discussed these things extensively. We got two different sets of documents. One identified that third case of the cancer patient, and another one then would have been correspondence received by local councillors in Mayo from concerned staff. So what was revealed in some of those was just shocking stuff. The staff were embarrassed, frustrated. They were threatening to protest. They had planned a lunchtime protest at around the time that these documents were done. So we drip-fed those documents then to the media and I suppose kept the story alive. And all the while we were calling for a progress update on the report that Simon Harris had asked Paul Reid for. And we were getting nowhere with that. Eventually then we got it under Freedom of Information. It was a 7-page report, now very carefully worded, so it didn't really level criticisms as such. You couldn't really call it a damning report, but it identified areas that need improvement, you know, or ways that we can better improve the hospital, which is, you know, highlighting the stuff that went wrong when you read between the lines. So then that report was covered extensively. Now, very curiously, the report was, when the media were discussing it, and it was in all local newspapers, it was on the radio, it was in national papers, I believe the Times Ireland and the Irish Independent were covering it. When that broke, there was commentary from the then Minister for the region, who was Dara Cleary, who, as we know, has since resigned his ministry, but he said that he had been trying to get a hold of that report. So he said that he had been seeking access to the report for weeks. So when challenged by journalists, he said he'd only seen it around the time that it was released to us and to the media under Freedom of Information. Now, we know that had been sitting on the Minister for Health's desk since, I believe it was the 19th of June. And this is only maybe 2 or 3 weeks ago we got the documents released to us. So it was very curious that there was a cabinet minister claiming that he was requesting a copy of the report, which the other minister had, which related to his constituency, and had to rely on unelected representatives to get a copy of that report under the Freedom of Information Act. It seemed there was a bit of a communication breakdown there. So yeah, it was very concerning. And then of course that we were questioning that how did this happen? But it was, I think, about the same day that the Golfgate scandal blew up. So all the attention turned away from our story and over onto that situation then. So.
I suppose really your story is very, very inspirational in that just because of your interest in what was happening and using FOI, you managed to get this information. And has there been any change now in hospital practices in Mayo University General Hospital since you've released all of this information to mainstream media and they've run the story?
There is indeed. I've never seen authorities to act so fast. I mean, the story broke on a Friday. By that Monday, there were builders in the hospital. There was going to be structural alterations. There were some wards, for example, that were sharing bathrooms, and the report had identified this as a concern. But almost immediately after the story broke, you know, there's a new 50-bed unit has now been promised for Mayo University Hospital. As I say, the workers actually turned up on the Monday, the next working day. But it was fascinating. I suppose my concern when I was talking to my friend who was involved in politics in Mayo, my concern and his concern was that he was receiving correspondence from members of the public who were very concerned about the safety of the hospital. So they were worried, you know, they talk about the non-COVID mortality. That was really the primary concern. We were afraid people were hearing these stories from inside the hospital and they were afraid to go to the hospital, and they were suffering. Their health and even their lives, were in danger, because they were refusing to seek medical help. So what we wanted to establish through asking the questions and pushing this story so vigorously was that the hospital was safe, that things were now under control. And we did establish that, it would seem, and there's going to be these improvements. That would be my message to anyone from the region that the hospital serves, Roscommon, or, well, not Roscommon, but that area, Mayo as well, that it is safe to go to hospital. And if you're at home and you're sick and you're worried, should I go to hospital or not, I'd be inclined to go to hospital. The other thing is that the families who were in touch really deserve answers. It is a national scandal, and I think I would urge more people to come forward. I'm hearing loads of people on the street, and you'd be talking to people, who'd say, this is what happened to my family member who was in the hospital at that time. I think we need to get public with these stories and keep the foot on the pedal. But also, I think we need to be prudent when we're campaigning on issues like this. We need to, like as I was saying, we got the documents under freedom of information, and we had 3 different sets of documents released to us. So that kept the story alive. It was every week there was a new bit of information that we could get on the radio about or get into the media with. So I think that's the main thing.
And I suppose, yes, it's a really good news story, and it shows the power of one person using FOI and then being able to work with mainstream media, having got that information, and the power of mainstream media then to get the story out there, and then that brings about pain. So it's hugely, hugely inspirational story. And thank you for sharing it with us this evening, and you'll join us later on in our panel discussions. Thank you so much.